The American Society of Transplant Surgeons advances the art and science of transplant surgery through patient care, research, education, and advocacy. We kick things off today with how that mission will move into the future. And joining us now are ASTS President Dr. Elizabeth Pomfret and President-Elect Dr. Ginny Bumgardner. Thanks to you both for your time today.
Thank you.
Dr. Pomfret, I want to get started with you. First off, congratulations to both of you on these roles. What have been some of your priorities over this past year?
So over this past year, we knew that there was going to be the OPTN modernization, and we've been very excited about that. And so probably the first priority, knowing that was coming up, was that we formed a work group of past presidents of the ASTS and presidents of the UNOS to work on guiding principles. And it was about 8 pages long. Really, that was very patient-focused, patient-centered to work on exactly what are the things that worked about the old system, what didn't work, and how do we improve it and improve the efficiency. And the other thing was really improving communication. One of the main things being that there are certain new techniques for being able to use organs that we typically weren't able to use. One of them being normothermic regional perfusion, and that had a lot of different ethical concerns. And last year at this time, the transplant community, which is probably the most important community involved in that, really wasn't part of the discussion. And we had a consensus conference last year at this meeting, and subsequently we've been able to develop standards, publish a paper on the consensus conference. So we have 4 different manuscripts that have come out and gone from not being part of the discussion to actually leading the discussion.
Incredible. Dr. Bumgardner, what do you hear from some of your fellow transplant professionals about some of the challenges that they face?
Yeah, I think in other years we could potentially focus on a number of different challenges, but I think this year the community is unified in its concern about how the approach to this modernization initiative is going to be rolled out. As Dr. Pomfret mentioned, we spent considerable amount of time looking at this at a very patient-centric, focused point of view, and with the idea of improving. I mean, the American Society of Transplant Surgery really has been involved with innovation from the very beginning in terms of even starting this field. And so we're very pro change and innovations to make things better for patients and make things more efficient, et cetera. And in fact, we're involved with the original legislation to create a network to support the transplant system. Since that time, our network is so much more complex. The patients that we take care of are very complex. The number of providers that are involved in what we do are just large now. And so all of that has to be taken into consideration when you're modernizing something.
Right.
And so as Dr. Pomfret said, we started out by saying, okay, here's some principles we think are important. We are the experts in terms of professionals. We're on the ground taking care of patients, taking care of organs, procuring the organs, transplanting the organs, talking to patients, listening to patients, et cetera. And we just found out really within the last a couple of weeks or so, that all of the recommendations that we've been making, advocating for patients, are not going to come to fruition because the changes that are being made are so drastic. It changes the whole public-private partnership, which has been at the basis for this whole transplant network. And what I'm hearing from our fellows is that the uncertainty in the system and the potential adverse effects on their patients are the things at the top of their mind about this.
So it sounds like there's still room for progress on this topic.
Not only room for progress, I think at this point there is a tremendous amount of concern and disappointment that so much time and effort has been brought forth by, as Ginny said, the people who are taking care of the patients, transplanting the patients, taking care of them on the ground day to day. And it really seems that all of those recommendations we've just been left behind, and this is becoming more of a government type of a process that we're seeing laid out that seems to eliminate to a
Clinical
large
expertise.
extent,
Right.
the clinical
Clinical
expertise and
expertise.
the voice of the patient. And that has our membership really speaking to the two of us and the council with tremendous concern. And so that's what our town hall will probably focus on completely tonight,
Okay.
because that's what people are most upset about.
Very understandable. Okay, before I let you go, obviously this is a joint Congress. How important is the collaboration between the AST and the ASTS, and what do your members get from being a part of ATC? Question for both of you.
I think it's very important. I mean, there are obviously many colleagues that we work with. I mentioned before, the community is very diverse now, so it allows for us to get together, debate topics, talk about innovation, and really advocate together for our patients. And I will say that our partners are with us on this issue that we've been talking about, because we feel this is a significant threat to the way that we have practice and a barrier to innovation.
Dr. Pomfret, as you look back on this past year, any key accomplishments, key highlights that you'd like to point out?
Well, I would emphasize what Ginny just said. Anybody who does transplant knows it's a team sport.
Okay.
Okay, so, we could not do what we do as surgeons without our medical colleagues and all of the other professionals that make it possible for us to do this. And so I would say the thing that I'm most proud of is the putting together finally a structured course to teach surgeons how to do adult-to-adult living donor liver transplantation. We've been talking about that for almost 20 years.
Wow.
And we finally put together a first in the U.S., first of its kind, quite frankly, course that just took place in April in Colorado, which was a 3.5-day course that was didactic and also hands-on course. And it was a tremendous success, and I'm very excited because it partnered both that course with a mentorship experience to be able to really grow the development of living donor liver transplantation in this country.
Wonderful. Well, congratulations
Thank
on a
you.
successful term, and best of luck to you in the upcoming year. Thank you both for your time today.
Thank you.
Thanks.